Hi, everyone. Welcome to Kate Talks, which is a show where I sit and talk about things that I've been pondering. I tell you what we know and what I think. Today, we are covering a topic that last year would have seemed absolutely ridiculous and unreal. I'm talking about masks, wearing them, not wearing them, shortages, past, present, future, and the morality of it all. So, we know that masks and facial coverings have been used historically during outbreaks of infectious diseases. They are meant to slow the spread of disease so as to not overwhelm the healthcare systems and crowded populations. When used effectively, masks can reduce droplet transmission from person to person. That's when used effectively. This usually means that everyone is wearing them in public spaces, wearing them correctly, and combining it with other ideas such as social distancing and good hygiene. They aren't a catch-all or a cure, but just another step in the routine to minimize case transmission. In the US, the usage of masks during the COVID-19 pandemic has been a charged topic from the start. Flashback to January 30th, when the first person-to-person case of COVID was reported. The CDC was not recommending face masks at this time. This lack of recommendation persisted for the first few months of 2020. This was probably to prevent a further shortage of PPE for healthcare workers. However, public buying panic ensued. By early March, it was almost impossible to find face masks or coverings in stores or online, not to mention toilet paper. As case numbers began to rise, the public was looking for guidance and answers regarding masks. On April 3rd, the White House Coronavirus Task Force and the CDC recommended that people wear a cloth face covering. These masks were distinct and different from the surgical masks and N95 respirators people had been buying up. These recommendations line up chronologically with many states implementing quarantines and stay-at-home orders. While these measures seem like they would be effective in slowing the spread, cases skyrocketed. As of August 6th, there are almost 5 million total cases in the US. When it comes to masks, there are two general opinions. You have your maskers and your anti-maskers. According to a report from the CDC, only 60% of adults in the US responded saying that they always wear a mask when they're in public. Around 20% said that they blatantly refuse to wear a mask. Why is that? To understand the difference in opinions, we need to look at what values each group holds dear. The maskers tend to value altruism, and they have a general respect and notion to care for others and can exhibit empathy. The anti-maskers, however, value autonomy, tend to be skeptical, and they follow the examples set by current political leadership. Although there were conflicting opinions about masks in the beginning of the pandemic, the scientific and medical community approves of them now. However, the opinion that masks are useless and just a way for the government to control its citizens persists. Why? Let's work through the skepticism. My gut feeling tells me that this debate is not just political or scientific, but it's moral as well. My gut feeling tells me to do what I consider to be the right thing, and that is wear a mask. My intuition is to act with minimum human decency and just have an ounce of respect for others. It goes back to the golden rule. Treat people the way you want to be treated. I would want others to cover up their snot droplets when they're around me, so I'll do the same. But where are my intuitions rooted? I'm thinking of Kantian theory. Kant believed that there were some actions that are absolutely prohibited, and there is an overarching principle of morality that can decide if actions are part of our moral duty as humans. This is Kant's categorical imperative. Imperatives like don't kill others and don't cheat on your significant other are commandments of morality. For me, don't place others at unnecessary risk for COVID-19 is a categorical imperative. Not wearing a mask would disobey this categorical imperative. So based off my respect for others, I find that wearing a mask is the moral thing to do. We can use another theory to look at why there are differing opinions in the mask debate. Moral foundations theory looks at how morality varies across cultures but still holds the same base themes. It was founded on the premise that there are universal psychological systems that form 5 different foundations of morality. For those that choose to mask, the foundation of care versus harm prevails. Humans have evolved to form attachment to others, and we dislike it when ourselves or others are in pain. To show our care for others or potentially protect ourselves, individuals will morally choose to wear a mask. For those that don't wear masks, however, The foundations of liberty versus oppression and authority versus subversion prevail. These individuals tend to challenge the restrictive actions of wearing masks that have been imposed on them by those holding the power. These individuals may feel that by having to wear a mask in public, their liberty is being compromised. These individuals have also taken to social media and publicly protesting so as to create a sense of solidarity among the outsiders. While I personally understand that not wearing a mask is disrespectful and potentially harmful to others, some think differently. It is also important to note that partisan membership and political beliefs have shown a slight trend between those who wear a mask and those who don't. Data compiled by the Pew Research Center shows that 63% of left-leaning individuals believe that others around them should always wear a mask when in public, while only 29% of right-leaning individuals believe so from the sample population. This shows how political beliefs can affect one's moral beliefs. While moral foundations theory believes that all of the 5 pillars or foundations exist at once, they are not always equal. While there is likely to be opposition to masks from a subset of all cultures, this issue has been exemplified in the US. I believe this is a result of our moral beginnings, how we were socialized, and the state of our polarized union today. But that's more than we can delve into for now. I hope you found this topic interesting and are able to clearly see the differences in morality between those wearing masks and those that aren't. Stay safe, and I'll talk to you soon.